from the gluten-free diet has more recently been talked about by Stu Shepherd, a dietitian from Australia, and Dr. Gibson, and they looked at about 50 individuals that were on the gluten-free diet for the long term, and their conclusion was that there are dietary inadequacies in the gluten-free diet that either have to do with the food choices that we make, so these are the habitual food choices that we make based on, eating too many refined grains or convenience food, but also because of the level of fortification or lack thereof of food products in the gluten-free diet. And so, of course, we're always wondering, why do we even bother to ask about the nutrition and nutrient value of food? It's because we're trying to figure out whether gluten-free food products should be fortified like their regular counterparts. I'm going to talk to you a little bit later about what the differences are and how we can address them. But let's go now to each and every one of these nutrients that you need to watch out for. So sources of fiber, some of the highest sources of fiber are, of course, things like psyllium husk or any kind of bran. So we're looking at rice bran or corn bran if you can tolerate. Or if you can tolerate gluten-free oats or pure uncontaminated oats, those are the kind of foods that have some of the highest amount of fiber from a grain. Kathy Smart mentioned Kavina Nuga. So those are the kinds of oats, pure uncontaminated oats, that contain a lot of fiber. Beans. Now beans, romano beans are lactose. For those with gastrointestinal conditions, of course, beans also contain fermentable carbohydrates and the kind of fiber that lead to bloating and gas. So you can never eat too many beans. Half a cup is probably the most you should have. Now, your recommended daily intake of fiber is anywhere between 25 to 30 grams per day. And so at half a cup, you're almost halfway through the day. Almost halfway through. If you cannot tolerate beans, A-okay. There are certainly other sources of fiber. Many people start increasing their fiber. They'll say, oh, I just add 2 tablespoons of flaxseed to my morning cereal, and then away I go. But you need to add in the fluid so that that fiber can actually absorb the fluid and increase in volume to help move things along. And so again, for every about 2.5 to 3 grams of fiber, you need to have at least 5 to 6 ounces of fluid, whether that be water or tea or any other fluid that you take. Again, green teas in the lentil or legume family, again, a very good source of fiber, and I mentioned the pure uncontaminated oats, and of course quinoa. Now, quinoa is first of all, it's not a grain, it's a seed, but just as any seed, it helps to complement your intake of fiber. Do you have any question about fiber then? Yeah. 25 to 30 grams for most adults. The amount actually, the recommended daily intake actually goes down with age. So once you hit 60 and over, you don't need as much, because again, the gut cannot process as much fiber, in the bread. Yeah.
Hi, the lentils have the fermentable carbohydrate also. Do lentils?
Say that again?
Do lentils
have
fermentable carbohydrate?
Yeah, so lentils, this is something, by the way, by Stu Shepherd, a dietitian from Australia, who herself has celiac disease, but was finding that despite being on a gluten-free diet, she was still getting symptoms of bloating and gas. And so she started looking at the amount of fermentable carbohydrates. These are things like fructose and fructose, and another type of sugar called polyol, which never really gets sorbitol and maltitol. Anytime you see an OL on sweetener, that's a sign of a polyol or sugar alcohol. And all of these sugars do not get fully broken down, and so they ferment, they make gas, they bring water into the gut. In some cases, people are very sensitive to them and have diarrhea. In other cases, they just experience a lot of bloating. So the legume family is just known to do that, because they have a very high amount of these fermentable fibers or fermentable starches, and so they cause a lot of gas, which is why you shouldn't have too much or else you will experience gas. Okay? Yeah. I can do it.
What would be the recommended?
Yeah, okay. I'll go back up. Okay, sorry, what's the recommended? So for children, we're looking at anywhere between, depending on the age, 10 to 15, but no more than 20. 20 would be the max. 10 to 15. Yeah. Could you? It's together. Yeah, so whether it's insoluble or soluble, I think at this point it doesn't really matter. But we know that if you have a sensitive gut, such as in the case of irritable bowel syndrome, you want to stay away from roughage for things that are too hard to digest. That would be the insoluble gut, like wheat bran. Although we're not talking about wheat bran here because of bread that we but things like citrus vegetables, broccoli, cauliflower, anything that's tough and fibrous would give you pain, gas, and bloating. And those would be the insoluble parts of the body. Okay? Alright, so we're moving on. Is that okay? Calcium. So calcium is again a nutrient that's very much missing in the diet, particularly if one experiences lactose intolerance or if one has a general sensitivity to dairy products. And not that it's necessarily important to get it all from dairy, although dairy seems to be a very easy and absorbable source of calcium. But what's happening, particularly with women, particularly those that have celiac disease, because the lining is damaged, the absorption of calcium and vitamin D from food or from any other sources is not there. And so there's a risk of developing osteopenia and osteoporosis with that lack of absorption. And so we really need to make sure where food products are not fortified and where we are avoiding dairy products in general, we have to be super careful with where we are getting our intake of calcium from. And so if you are sensitive to lactose or milk or even lactose-free milk, what you can do is have a non-dairy alternative that is fortified. So make sure that if you get almond milk or rice milk or soy milk, you tolerate soy milk, that you find a product that is fortified. It's usually fortified with calcium carbonate. So again, make sure, do know that calcium carbonate, not all of that amount of calcium is fully absorbed. So you need to also find other sources to get your calcium from. Tofu is a good source of calcium if it is prepared with calcium or manufactured with calcium sulfate. If you don't have, or if you have an intolerance to soy products, which tofu would be made from, you know that small fish, any kind of fish that has a bone in it, like sardines, or, for example, salmon, canned salmon with a bone, it's the bones that help give the calcium. There's also another little fish that I personally like. I don't know if you know about it. It's called smelt. And they're tiny little fish. In Europe, they make smelt, particularly Portugal and Spain. They prepare smelt by coating it in a bit of egg and some cornmeal, and then they either bake it or fry it. And they put a bit of salt on it, and it's absolutely delicious. But it's the bone that we're looking for, something like not even 6 medium 30, even less than that.
Yes.
If you have smelt, even if you have about 10 to 15 little fishes, it will give you about, or smelt, it will give you about 572 milligrams of calcium. Now, what are the recommended daily intakes for calcium? Women need to get anywhere between 1,000 to 1,200 milligrams per day. So, if you think that 1 cup of let's say, lactose-free milk or non-dairy alternative gives you about 300, so you need about 3 of those a day. If you tolerate dairy products but are lactose intolerant, you can have cheese that has no lactose in it. So you can have, for example, things like cheddar cheese or Swiss cheese or Parmesan. All of these cheeses, the hard-aged cheeses, are lactose-free naturally because they've been hard-aged for a long time, and so that bacterial culture has had enough time to eat away at the lactose. If you want to avoid dairy altogether, then sardines are your the next best bet. The other thing is roasted sesame seeds, or sesame seeds in general, very good source of calcium, and so is tahini, which is a sesame seed butter. Nobody really knows, sorry, I got to talk to the microphone. Nobody really knows, but things like kale and these are collard greens. They don't look, they look kind of tiny. They've been sitting out for a long time. But collard greens are greens that are typically used in Italian cooking and some sort of Spanish cooking. They work really well in soups, but also with sausages. So sausage and collard greens and rice. Collard greens, dark leafy greens, give you a good 140 to 200 milligrams of calcium per serving. This is just half a cup. If you have a cup, you're at about 240, 300 milligrams, which is about the same as a cup of lactose-free milk or non-dairy alternative. Almonds, everybody talks about almonds as a good source of calcium, but to be honest with you, I would rather go for something like sesame seeds to have my seeds are an excellent source of calcium. And if you can get about 200 milligrams of calcium from sesame seeds or chia seeds or sunflower seeds, you are a little bit farther ahead than having almonds. Not to say don't have them, but don't rely on almonds as your only source of calcium if you do. Okay, next we have folate. So folate, as I mentioned earlier, is very important for tissue regeneration and tissue building, particularly when you have celiac disease and you want the lining to heal the lining of the intestine. Now, some of the best sources of folate might not be appealing to you. The recommended daily intake of folate is 400 micrograms. Now, there's been studies out there that have linked too much folate with the incidence of colon cancer. And why? Because, again, folate can help with tissue building and cell, whether it's red blood cells or tissue cells. So when you have cancer cells already pre-existing, folate would help them regenerate and grow. Anyway, so it's taken about 10 years to refute those studies and to find that actually there is no association between higher folate intake and the incidence of colon cancer. Having said that, what happens with regular baked items, so I'm talking about the wheat stuff, is that they're not naturally. They are mandated to be fortified with folic acid. And that's usually to prevent spina bifida, which is of course something that happens in the early stages of pregnancy to babies. But gluten-free flours are not typically fortified with folic acid or folate. And so this is why you need to be aware of the kind of food products you're buying to see whether they are fortified, and if they're not fortified, then you need to get it from somewhere else. So, again, beans and peas are an excellent source of folate. What do you do if you can't tolerate too many beans and peas? I mean, you need about 400 micrograms per day, and one cup of beans gives you about that much, about 364 micrograms of folic acid per day, or folate. But you can also have spinach. So spinach and the dark leafy greens are, again, a very good source, an excellent source of folate, and so is broccoli. So a cup of broccoli, which is pretty good of broccoli actually, gives you about 168 micrograms, let's say about 200, about half of your recommended daily intake. Okay? And if you buy, now what's happening lately, which is why I'm excited about shows like these, is that manufacturers of pasta have started fortifying their flours with folic acid, which is a B vitamin, and other B vitamins like thiamine and riboflavin and vitamin B12. And so it's very useful to look on the nutrition label and to see if those rice pastas or gluten-free pastas, I shouldn't say that they're not all rice, they're quinoa and combination of rices and so on, if those pastas have been fortified. Maybe not to the same degree as the regular counterpart, but at least there is some degree of fortification, and I think we're going in the right direction with that. Iron, like I mentioned before, iron was very hard for me to get as part of and it's hard for many women to meet the recommended daily intake of iron of 18 milligrams per day, and like I said, in pregnancy, that amount goes up to 27 milligrams per day. There's one grain, gluten-free grain, that Kathy didn't mention, but I'm hoping she will mention it next year. And it's lucky that we live in a cosmopolitan area like Toronto, because we can go to Asian stores and find a grain that they've been using for many, many years called job spears. The other name for it is hatomuji. And so I find these in places like Galleria or TNT or any of the other stores, and they're about $6 per package. What these are, you can use this very much like a rice or a quinoa. You would cook it, boil it in water. You would add some mushrooms, maybe some green beans, a little bit of sesame oil, and season it with salt. And then there you have a side dish that for 2/3 of a cup, so not even a full cup, gives you about 17 milligrams of iron. There's your recommended daily intake of iron right there, in just 2/3 of a cup. You have again liver, thanks very much. That's not very useful for most people, but things like oysters and clams, seafood is typically quite high in both iron and zinc. And again, you only need about 2.5 ounces of it, which is not very much. To me, to be very close to at least half of your recommended, or 1/3 of your recommended daily intake. Teff is another one. I think Kathy mentioned teff. But it's a gluten-free grain that, again, in just half a cup gives you about 3 milligrams of iron. And then, of course, beans. Beans, again, are an excellent source of iron. But again, if you have symptoms, gastrointestinal symptoms, beans and lentils. If you have gastrointestinal symptoms of bloating and gas, you should only use about half a cup at most to be able to tolerate them. So it would be great if, all things considered, iron is probably, I would say, that one of the hardest nutrients to meet from just regular foods. And so it would be great if some food products were fortified with it. It's just that it's a problem not to over-fortify with iron, because you can easily achieve a toxicity level, and this is why manufacturers are a little bit reluctant to fortify with too much iron. But even a little bit, I think, would definitely help. Do you have any questions on iron? Because it's a really tricky topic. Yeah?
Can you also use iron skillet or add water to put it in?
Oh my. You definitely could to get that, but the only thing is you can't quantify how much iron gets from the skillet into your food to be able to say, well, are you getting enough from just doing that? I know people do that, but it's not typically recommended because of the safety issue, and again, not really knowing. You see, iron has to be absorbed. So there's the one thing I'm not mentioning in here, there's 2 types of iron. There's a heme iron, the iron that comes from essentially blood. So in red meat and all those sources that we all know about. And that iron is very easily absorbed through the gut, through the intestine, and into the bloodstream. The liver is another one. But iron that's from vegetarian sources, like legumes and so on, and grains such as hatomuji, it has these oxalates, these compounds that keep it trapped. And so we need to make sure, so the kind of iron you're talking about from the skillet, not sure that it's easily absorbable. And in fact, from vegetarian sources, only about 20% of the iron is actually absorbed. So we need to make sure we maximize, when we use vegetarian sources or other sources of iron, that we need to maximize the absorption of iron. And that would be by including a source of vitamin C, so making, for example, a chili dish with, a vegetarian chili dish with a tomato sauce. That's an example that a lot of people use. Or simply just having some, squeezing some lemon on the hatomuji dish, for example. or on the oysters, or on the clam, just having some lemon because that's acid, essentially, or vitamin C. And then avoid having the source of iron with too much calcium or phosphorus. So do not have a glass of milk with your bean dish, for example, because the calcium will compete with the iron for absorption.
Of all the missing things, would you recommend for iron that you do a supplemental with an iron capsule?
If you cannot, see, the problem with iron supplements is that sometimes they cause digestive upset. At least in my practice, I see a lot of patients. I didn't introduce myself properly, but I'm a dietitian in private practice. I specialize in gastrointestinal conditions. I see a lot of people with celiac disease, Crohn's, colitis. I've been working with the Canadian Celiac Association for a very long time. So what happens with iron supplementation is that the ferrous gluconate or the ferrous, most likely ferrous gluconate, the doses are so high and the formulation really makes it very tough for the gut. So sometimes people get constipated, they get cramps and so on. So if you can tolerate supplements, you can substitute if you're very, very low. Now only if you have either an iron deficiency or an anemia, you need to supplement. But otherwise, food should be able to.
What about soaking? Soaking the grains, soaking
the beans and stuff?
beans.
Sure, okay. Yeah, so as long as you throw away the soaking water, because that would have all those fermentable sugars that would dissolve in the water. Make sure that you throw it out and you do not use it. And then you can pretty much cook the beans as much as you can. Also pureeing them would also help to break down some of those fibers. At the end of the day, the sugars aren't going anywhere. Those fermentable sugars, they're still in there. So eating too much of those beans will almost always give you some gas. And it depends on the sensitivity of every single individual. Some people are more sensitive than others. Some can eat a cup and a half of beans and have no problem, and some can have a quarter of a cup and, help absorb that's what you're asking. I think cooking, if anything, would do that trick instead of soaking in water. Because, for example, with spinach, so raw spinach, the bioavailability of iron is much smaller than when you cook it. So it increases in cooking because heat sort of breaks down that bond between the iron and the oxalate. So in many ways, with beans, the same thing can happen. When you cook the beans for a long period of time, it can liberate some of the iron in there. Yeah. So heat can do that. Okay? So I'll just keep going for a little bit longer, and that is only to say that if you are looking at the gluten-free diet as a weight loss diet, you need to think twice about it, because it isn't always a weight loss diet, particularly if you have celiac disease and you are healing, you're going on a gluten-free diet. So what happens there is that the lining of your intestine heals, so you're absorbing a lot more of your nutrients, but also your portion sizes might be higher than what you think. So for example, if you, point. So in the rice pasta, this is a really good. So the rice pasta, 150 ml, so that's about half a cup cooked. It provides 42 grams of carbohydrates. The wheat pasta, for the same amount, you're only getting about half of that. Okay? So you need to pay attention, because the other thing that happens, and I'm sorry I don't have it here, but I usually do a presentation where I boil gluten-free pasta, rice pasta, and then regular pasta. What happens is that the regular pasta tends to increase in size, tends to get bigger, so it fills up the plate. The gluten-free pasta sits as it is. It just stays there. So you're tempted to fill up the plate more because it doesn't look so it doesn't look as full. And so you end up almost always having a larger quantity than you would for the regular counterpart. So you need to pay attention to the portion sizes because altogether you're already getting more carbohydrates. If you don't pay attention to the serving size, you're going to get even more. So that's where the extra calories come from. The other thing is, gluten-free food products, they do the best they can to mask the taste profile and to make it a tasty dish. But at the end of the day, they will add probably more fat and more carbohydrates and more sugar per serving. So this is where the extra calories come from. And then mind the portion size, which is what is really, really important. And most importantly, please do not try a gluten-free diet before being properly screened for celiac disease. It's really, really important that you know for sure you don't have celiac disease, and then if you just have a gluten sensitivity, you can deal with that. The problem we're seeing right now in the medical community is a lot of people are taking on the gluten-free diet without being properly diagnosed. And we have what's called an iceberg model, where we know we've diagnosed the tip of the iceberg, but there's a lot more people with celiac disease that we don't know about under the water. And taking on the gluten-free diet prior to properly being screened for celiac disease will keep you under the water, because then it's so hard to go back on gluten to get properly tested. Once you've been off of gluten, it's so hard to get back on. Anyway, that's all I have for you. I hope you enjoyed it, and let me know if you have any questions.